Hello everyone, yeah, good afternoon. We are going to have an interview today with one of our clients who went here in Bangkok for his spinal surgery. May I introduce you to Ms. Edward
John Williams.
Mr. Edward John Williams. Hi Edward. First question would be, why did you choose to have your surgery overseas instead of doing it in Australia?
I couldn't take the pain anymore in my back, and plus I needed something to be done straight away, and coming to Thailand was a cheaper option than having my operation in Australia.
How long were you in pain?
I was in pain for 2 years.
Okay. How did you find global health travel and your overall impression during your first contact?
Very good, very professional, as well as very helpful with regards to trying to help me get my back sorted out.
Okay. How long did it take before you were able to get an appointment here in Thailand?
It was pretty quick. In the process of about 3 weeks, I made contact with Global Health Travel, and my contact Sharon booked me an appointment, and it was pretty much done within 3 weeks.
Were you nervous before coming over here?
Very nervous, very apprehensive. Obviously, my wife was apprehensive as well, very nervous. But after looking at the doctor's resume and looking at the hotel and doing a lot of research, I knew it was the right choice.
What did your family think about doing your surgery overseas?
My family wanted me to have my surgery as soon as possible because they could see how much pain I was in, and they wanted me to be well.
What was your first impression of the hospital?
I was overwhelmed with just the professionalism, the neatness of all the nurses, how clean it was. Just a brilliant hospital.
And we're glad that you're very pleased. Who was your doctor?
Dr. Veripan. He's very good. I also looked at his resume, and he had an outstanding resume with regards to what he has done in his medical profession.
How did you feel after walking out of the consultation room and after seeing your doctor?
I felt very good and very confident. Obviously, having a second opinion with another doctor just confirmed that what I needed to have done was quite serious and needed to be done straight away. And it was great having a consultation with Dr. Veripan.
What was your clinical diagnosis after a series of tests done? And was it any different with what was diagnosed to you before coming here?
Yeah, it was different. I was told that basically instead of having my whole disc removed and an artificial one being put in, I just had a discectomy done, which was just removing part of the disc that was pushing on my nerve. So this was good with regards to just getting rid of what was actually causing the pain instead of having the whole disc replacement done.
When did you have the procedure done, and what are the series of tests that needs to be performed before you were cleared for surgery?
The procedure was done last week on Wednesday, and I had a number of tests done in the hospital on the Monday before the surgery, just to make sure that everything was good and everything was clear.
You mentioned that you had discectomy, right? And what was the prognosis after the surgery?
The prognosis after surgery was that the disc that had to be removed, the part of the disc that had to be removed was removed, and I had a big tear sewn up in my disc, which was not normal to other discectomies. Other discectomies only have a small tear, mine was quite large, so the prognosis was that we just got it in time, which was good.
How did you feel when you woke up? And are you still in pain now?
I felt great when I woke up. There was no more pain. I had no more pain down my left leg. I've just have slight pain at the moment, which is just basically just from the operation. and my pain is disappearing every day.
Oh, that's good to hear. How much did the procedure cost in total?
In total, I would imagine a quarter of the price what it would cost me in Australia, which is about $15,000 to $16,000.
Ah, that's a good say. So the big question is, would you recommend other Australians who are on a long waiting list or suffering in pain like you did before to travel overseas and jump the queue to have elective surgery?
I certainly would recommend people coming over to Thailand, especially to this hospital, to have any procedure done, not just back surgery. I would recommend anyone to come and have any procedure done, just due to the professionalism, and getting sorted out straight away, and not having any more pain, which was the best feeling.
There are lots of Australians in a similar situation who are in long waiting lists who think that you are probably crazy traveling to Thailand for spinal surgery. Do you have anything that you would like to say to them?
Well, I've done some crazy things in my life before, but this was crazy. But you know what? It's been great that I've come over here and done this. Otherwise, I would be in pain for another year before anything would be done in Australia on private health. And plus, I would still most probably pay the same amount of money on my private health according to the gap. So I would recommend anyone jumping on a plane and coming over here and getting their pain or whatever they need to be done sorted out.
Do you have any tips or any suggestions for those people?
The only tip is just when you're here, just have an open mind, and just remember this is an international hospital, so there's all types of nationalities here, so you just need to be aware of that.
And lastly, how did you find the pre-operative and post-operative care and the assistance provided by Global Health Travel?
Oh, great. I had a great nurse who looked after me. Her name was April. She came and checked on me every day, obviously took my blood pressure after the operation and made sure that I was well. And it's just great having that, knowing that, there's someone there who's looking after you all the time, when you've had your operation. Pretty good.
So would you recommend them?
Oh yeah, definitely. Definitely.
Thank you, Edward, for taking the time to talk to us today. We are so glad we were able to help you. Hopefully we can help more Australians in a similar situation. So good luck, and we wish you a speedy recovery. Thank you.
Thank you. No